Hey Blockheads, my name is Shelly Galligan and I am a registered nurse. Today's fun and exciting topic is wound care on the water. We're going to talk a little bit about how to handle simple wounds on the water while you're out sailing, what you can do to handle these things. And it can be a little bit scary because there's blood involved, sometimes people are squeamish, and it's a topic that we don't really usually talk about. So we're going to go through it, I'm going to give you some information, and so when it does happen, you're going to be able just to act. You're just going to react on instinct and you're going to know what to do. There's about a zillion ways to cut yourself out on the water. And wounds go by many different names. We've got lacerations, avulsions, abrasions. We don't even really need to know any of that. There's really just two kinds of wounds when we're out on the water. There's simple wounds, minor wounds, and there's high risk or more complicated wounds. So the key difference in determining whether something is a simple wound or a high risk or more complex wound is how many layers it goes through. The skin is a little bit like a lasagna. It has all kinds of different layers. It has an upper epidermis layer, which is mostly just dead skin cells. It has a middle layer that has some small blood vessels and small nerves, maybe some hair follicles and sweat glands. And then it's got a deeper layer, and that's where muscles and bones and tendons live. And what separates those shallow layers from those deep layers is a layer called the fascia, which is a dull, white, fibrous layer that looks a little bit like unfinished fiberglass. So when we're deciding whether a wound is simple or high risk, we don't look at how deep it is, because a wound on your back or on your backside could be this deep and not go through that fascia, but a wound on the back of your hand could be this deep and go through that fascia. So the first step is to determine how many layers we've gone through. So the things we don't want to see when we're looking at a wound, we don't want to see shiny white stuff, and we don't want to see dark red stuff. If we see things that look like that, we've penetrated that fascia and we've now gone down into more of a high-risk wound, and this is a reason that we want to call in help. When you see things like shiny white stuff and dark red stuff, it's time to invite somebody else onto the boat. Today we're focusing on simple wounds and what we can do to handle them on the water, using 5 easy steps. So step 1 is to stop the bleeding. And bleeding is best controlled with direct pressure, and that's just taking your hand and putting it directly over the wound and holding it tight for about 15 minutes. Try not to peek, because that'll just start it rebleeding. Hold it for 15 minutes. If you can't get the bleeding to stop, it just means that you're probably not holding it in the right place, not holding it firmly enough, or not holding it long enough. So try again. Step 2 is to inspect the wound. We want to take a really good look at it because sometimes the wound can appear simple, but it really has gone through that fascia layer and it's a more complex wound that would require a little bit further care. So take a good peek, look underneath. If there's a flap, lift it up and look and see what's going on inside that wound. When you're doing wound care with any of these steps, it will be important to be wearing gloves, protective eyewear if you've got it, even just a pair of sunglasses, and always keep your mouth closed because you never know when something's going to kind of squirt out of there. Step 3 is to clean that wound. Early aggressive wound cleaning is the best thing that we can do to prevent infection. So how do you clean a wound? A little bit of soap and water. And water that's clean enough to drink is clean enough to wash a wound with. So a little piece of gauze, put some soap and water on there and scrub that wound. If it's really gunky or you feel like there's debris in there, we need to irrigate that wound. And that's just a fancy way of saying that we're going to spray a little bit of water through it. So take your water bottle and pour it over the top and wash out any debris that might be in there. Now the cleaning process might start rebleeding again because you've disturbed that clot, and that's okay. Just go ahead and finish cleaning that wound and then go back and put direct pressure back over that wound until you get the bleeding to stop again. So step 4 is to apply a dressing. Now that we have this clean wound, we need to cover it up with something to keep it clean, to keep it protected, and to keep it from getting infected. And that is to put on a dressing or a bandage. Before we do that, spread a little bit of antibiotic ointment or Vaseline over the wound. That'll keep the dressing from sticking so that the next day when you go to change that dressing, the dressing isn't stuck to it. The next thing that we'll do is to cover it with something non-stick, like a Telfel kind of dressing. We'll put something non-stick over that and then wrap it up. Make sure when you're wrapping it up, you're not wrapping it too tight because we don't want to cut off circulation and we want to allow the wound to drain. And even if you don't have a kit with you with all the perfect supplies in it, do what sailors do best. Improvise with what you've got around you. So step 5, the final step, is the aftercare of the wound. We want to wash that wound each day, a little bit of soap and water. This is the perfect time to check it for infection. And we'll talk about the signs of infection in a moment. And then reapply a clean dressing. So the signs of infection are increased redness, swelling, pain, pus coming from the wound. If you see any of the signs of infection, it's important to follow up right away. Now initially, a wound can be red. In the first 2 or 3 days after the injury, it may appear a little bit red, but that should be getting better. Infection tends to show up 2 to 4 days after the injury and get worse. So if you see any of the signs of infection, get that wound checked right away. So parents and coaches, we've talked to the kids about handling simple wounds out on the water. What are we going to do about complex wounds? These are wounds that have gone through multiple layers. These are wounds where we might see shiny white stuff and dark red stuff, things like muscle, bone, tendons, and ligaments. This is scary stuff, and it looks scary, but essentially we're treating it the same way. We're going to stop any bleeding. We're going to inspect that wound. If we need to clean it at all, if there's no life-threatening bleeding, we can rinse it with a little bit of water, and then we want to go ahead and put a cover over the top of that. Let's put a non-stick dressing and wrap it up, and then we can seek medical attention immediately. Let's make sure that our kids' tetanus shots are up to date. A tetanus shot needs to be within 5 years of a high-risk wound or within 10 years of a simple wound. If you think your child needs a tetanus shot, let's get that taken care of right away, ideally within 72 hours. There's one other wound that I'd like to just give a little bit of attention to, and that's the scalp laceration. So this is a common wound out sailing. This is a whack in the head with a boom. And it's a little bit different than a regular wound because it looks worse, and it often looks worse than it normally is. The hands, the face, and the scalp are really vascular, meaning that there's a lot of blood vessels there, and even the smallest wound to the scalp is going to bleed like stink. We can't let this throw us. We treat it like any other wound. We stop that bleeding with direct pressure, only this time because it is such a vascular area, let's hold that pressure for a good 20 minutes. Then we could go ahead and clean it, apply a gauze dressing, and even just a ball cap over the top to cover that up and to keep that dressing in place. And lastly, let's keep in mind that we want to make sure that the child doesn't have that traumatic brain injury that we spoke about in another video. I know it's a lot of information, I know that it can sound scary, but the more we talk about these kinds of things, the easier it's going to get. You've totally got this.